Over 30 million people have taken DNA ancestry tests with companies such as Ancestry DNA and 23andMe in an effort to learn more about their ethnic ancestry. However, these tests can reveal shocking surprises about parentage. For example, some users will learn through these tests that their assumed father is not their biological father. This is known as a not parent expected result, or an NPE. How frequently does NPE occur, and what is the experience of people learning NPE news? To learn more, we spoke to 3 leading experts, beginning with Dr. Maarten Larmuseau, who has worked on this issue for many years.
There are absolutely different cases of non-parent expected. The most common case is that the father, the social father, is unexpectedly not the biological father due to unfaithfulness of the mother. There are other possibilities as well for non-parent expected, like an untold case of a sperm donor or egg cell donor. Today, and also in the last 500 years in the Western society, we found 1.5% of the children has unexpectedly another biological father. If you have 1.5% of the population, it's a lot of people. So if you have millions of people who are buying the direct-to-consumer DNA test, a lot of them will find out that there is a non-parent expected case.
A recent study conceived by Dr. Rob Whitley documents the psychosocial experience of adults who had a not parent expected discovery after taking a direct-to-consumer DNA ancestry test.
We interviewed over 50 people who had experienced not parent expected news as a consequence of taking one of these ancestry DNA tests. And then we analyzed the data looking for common themes across the individuals, across these 50 individuals. And there were 5 overlapping themes. The first theme is that participants typically describe their experience as an extraordinary shock that had a negative impact on their mental health. So, for example, we had many people who said it actually precipitated a discrete mental illness, for example, an episode of depression, clinical anxiety, post-traumatic stress disorder, whereas others talked about mental health more generally and said it really disrupted their taken for granted assumptions about the world. Many of the participants used the language of grief, used the language of loss, used the language of bereavement when they were talking about their experience. What they said was that they felt that they had lost half of themselves in this process due to finding out that their assumed father was not their biological father. They said that they had lost the family that they did not know, who they never met, that they'd lost something in their relationship with their assumed father, who was no longer their biological father. The second theme was the theme of self-identity. The results indicated that learning such news led to a severe and troubling disruption of participants' self-identity. So, for example, when you learn that your assumed father is not your biological father, and then you learn your biological father is actually a very, very different ethnicity, even a different race, a different nationality, a different profession, a different life experience, that really impacted the participants' self-understanding. This led to very troubling cognitions regarding the big questions in life. Who am I? What is my place in the world? How am I networked into my own family and my own ethnicity? And this was very difficult for people. So we know from this study that when people receive this news, one of the big questions they have is, did my assumed parents know about this? And in most cases, the mother and the assumed father knew about this, but decided to keep it secret from their offspring. And so this was a veritable shock. They had no idea and many of them talk about a sense of betrayal, that they'd been lied to by their parents, that there'd been a secret, and sometimes other people were even in on the secret, uncles and aunts, grandparents, even siblings. And this led to a huge loss of trust. Many people in the study were able to reach out to their biological family on 23andMe or Ancestry.com. And some people say they've been able to establish a really positive, warm and good relationship with these individuals, whereas others say they've been, after a few messages have been exchanged, they were basically ghosted, been rejected from their biological family, and this was also very hurtful to the individuals. The fourth theme relates to the resources that were used by participants to try and help them come to terms with this situation. And one thing we found in the study is that spouses were incredibly important, that some people talked about their spouses being their rock. Others talked about siblings being very helpful, and others talked about online peer support groups. So there are some online peer support groups, for example, the MP Friends Fellowship, where individuals can talk about their issues in a space where there is anonymity and peer support from people who have lived a similar experience. And these were considered extremely helpful by those who use them. The final theme that we were interested in was the relationship that participants had with mental health professionals. Many participants talked to therapists, to counselors, to psychologists, even psychiatrists, and some of them reported a very positive relationship and that they'd helped them overcome these issues. However, some participants said that these therapists were not very well equipped to help, that they lacked training, that they didn't seem to understand the situation. The people who benefited most were those who said they used therapists who had experience in trauma, in grief therapy, and in bereavement therapy. And that was actually a common theme throughout the interviews. Individuals used the language of loss, of trauma, of grief, of bereavement. And that's why I feel the trauma-informed therapists were considered helpful by the participants.
For many facing the emotional whirlwind of an NPE discovery, finding the right resources and support can be essential. Rebekah Drumsta, an advocate and leader in the NPE community, has dedicated herself to creating resources and fostering support, most recently as CEO of the nonprofit NPE Network.
NPE Network was the first organization to offer any form of support for NPEs and their families. NPE Network started as a Facebook group, and now there are thousands of individuals that can all come together. There's meetups. Organically, people will arrange meetups in your little communities. Meet at a cafe, meet at a restaurant, go to a movie together. There's events, there's retreats, there's been a few conferences, and then from there, it's up to you how active you are. If you just sit and you read, if you're just the person I just need to hear the stories, I need to see some faces. If you want to get involved, if that's what you need to do, you need to share your story, you need to talk, or maybe you want to host a local meetup. Those are options that you can do through the NPE Network Facebook groups.